Hello, my name is Dr. Amanda Wilson. I'm an assistant professor in environmental health sciences at the Zuckerman College of Public Health at the University of Arizona. I saw the American Lung Association Catalyst Award as an opportunity to build on some of my current training with one of my really key mentors, Dr. Lynn Gerald. I'm training in areas of risk perception and building on my skill set in risk assessment, and I'm looking for ways to use risk assessment to improve respiratory health. Dr. Gerald shared this opportunity with me, and we worked together to put together a proposal, and I'm very grateful that it was funded, and it really has allowed me to grow a lot as a scientist and look for innovative ways to apply risk assessment methodologies to improve respiratory health. The specific focus of my training and research through this award is in the area of school health and improving schools' abilities to combat respiratory viral disease. Our main focus in this is to improve not only the health of all students, but especially students who are at high risk of really negative outcomes if they are having respiratory viral infections in schools, such as asthmatic students. There's a lot of opportunities to improve environmental transmission reduction. And I think the COVID-19 pandemic showed us this, but we know that COVID-19 is not the only threat. We also have concerns about RSV, influenza, rhinovirus, and more. And so we're looking at ways to create tools to support school health. The pandemic also emphasized the fact that school health needs increasingly available and free and easy tools that they can use in decision-making and intervention support. So our objective with this work is to use risk assessment to build a risk calculator tool that school health staff can use to inform interventions in the face of respiratory viral disease outbreaks or in preparation for things like flu season. We've been conducting online surveys and focus groups with school districts in the Arizona state and mostly within Pima County to learn about barriers and strategies to combating respiratory viral illness in schools. And we're iteratively improving the design of our risk calculator tool based on this feedback. So far, we're finding that there are barriers to implementing some of our most powerful interventions, which are engineering controls. These are really strong interventions because they don't rely on humans. And we know that as humans, we're not perfect. But the downside to engineering controls is they often require money. So we're learning how to work with school health in using a risk calculator tool, not only to inform interventions, but also for advocacy to administration, to show them quantitatively what some of these engineering controls, such as improved filters or better air circulation, could mean for schools and for the health of their students. We're also learning from teachers that these tools could be powerful for communicating with parents. And this is one of the biggest challenges that we've been discovering with school health staff is the fact that parents often push back on some of the interventions or protocols that they have in place to reduce respiratory viral spread. We're learning that if this tool could be used for parent-facing communication, it could be really valuable. Our next steps are to improve this tool based on some of the feedback we've gotten from the focus groups we've conducted and the surveys we've conducted to date, and also to measure its ability to increase the quality of decision-making. There's some really interesting literature and approaches in the area of patient decision aid research, where researchers are able to measure quantitatively how an instrument improves a variety of criteria that are considered important for informed decisions. And we're applying those ideas to our risk calculator tool, which to our knowledge has never been done before. So in conclusion, I'm really excited about the work that's been funded by this award, and I'm extremely grateful for the award and what it's enabled our team to do. And I think this next year of our research timeline is going to be really exciting in terms of not only improving our tool, but seeing quantitatively how it might be improving the quality of decision-making in school health.